I would like to start by welcoming everybody this afternoon on 4 o'clock on a Tuesday afternoon in a busy week at the legislature. We are so excited tonight to come from West Virginians for Affordable Healthcare. I'm Jessie Ice. I'm the executive director. I have a whole host of interesting speakers today, this afternoon, talking about something that's extremely timely. We are working all together, Republicans, Democrats, all across the board, to really help those with diabetes this year. Last year, we made a huge concerted bipartisan effort where, we passed a copay cap on insulin, and that was so great. Like, we were so excited about that. It felt so good. So we want to build on that. So what we've got going on today is a little webinar here, media event, people event, constituent event. Everybody who's here is welcome to listen to this and hear about what we want to do this year. So we want to build on those changes, and what we really are looking for, and the speakers will speak to this, is copay caps on insulin. Lower them down. We did a great job last year. Let's get them a little lower. But also, the supplies and other prescriptions that folks trying to live with diabetes, are living with, it becomes an extreme financial burden for families just to stay alive. So we are so grateful for our delegates and senators who are working this year to try to help that a little bit. So we actually have two bills we're gonna talk about, and the first one is the House Bill 2708. This one was the original going in, capping insulin, but not just insulin, other supplies, other prescriptions, because it's not just insulin that diabetics need. So we know, like, folks like Delegate Fleshauer and Rohrabaugh and Worrell, like, they all are working to make this easier for West Virginians. So we've got a House Bill 2708 and a complementary bill in the Senate 694. The thing about these bills is they're very complementary. We just want something that covers these issues to pass. So I explained, they cover not just insulin, but those other supplies, those other test strips, monitors, whatever the gadgets that diabetics need to be healthy. So it's an all-encompassing bill, and I don't want to take up all of our time because I'd rather give it to our delegates who are working on this. So the first speaker I am introducing is Delegate Fleshauer. She was a champion on the bill last year and is pushing it really far forward this year. So I'm going to turn it over to you, Delegate Fleshauer.
Thank you so much, Dr. Ice. And I want to say a big thank you to all of the activists who are on the call and the delegates and senators, all of whom played critical roles last year when we passed the first bill setting the copay cap on insulin. I want to especially thank Gary Doherty, who is from the American Diabetes Association, because he told me about the Connecticut bill, which passed last year. And what our bill does, following the Connecticut bill, it sets up 3 copays. And Jeanette is on the call. It's $25, $25, $100. $25 for insulin per month, $25 for non-insulin drugs, and then $100 for equipment and supplies like pumps and continuous glucose monitors and strips, like Dr. Rice said. The reason why the Connecticut bill is so important, two big reasons. One is West Virginia has the highest death rate in the country from diabetes. Connecticut has the lowest death rate in the country from diabetes. Connecticut is also the seat of the insurance industry, which is in theory where we might have the opposition. And I just checked today, the roll call vote in Connecticut, in the Senate, Senator Stallings, it was 35-1. In the House, it was 145-0 with 6 people absent. What we're worried about here is that if one of these two bills does not get on the agenda, it is going to be dead for the session. And, you know, that's kind of an ironic word. This bill will save lives. There are people on this call who cannot afford a pump or a continuous glucose monitor, and they could live longer and their lives could be saved. But I will toss the baton now to my colleague, Delegate Evan Worrell, and he will briefly talk about his views on the bills.
Thank you, Barbara. I appreciate it. And good afternoon, everyone. I appreciate having an opportunity to speak to you all, and for Barbara for championing this effort. And as we talked about, Dr. Rice said we passed the insulin cap last year, which was extremely important. It didn't go as far as we wanted, but there were compromises made, and we got something done. And with the idea, Barbara and I talked about this last year, that we would come back and we'd go after it again to lower it again. And now we're looking at those prescription non-insulin drugs as well, or supplies, for example. And while I don't have a personal story, it doesn't mean I don't hear from constituents. And I have very close friends who struggle with diabetes and have had to, afford life-saving medication. Now you'll hear arguments about price fixing, for example, and I'll tell you why I disagree with that. And as Barbara knows, she took a trip to Canada last year. These manufacturers, as limited as they are selling these drugs in other countries for a lot lower prices than what they're selling them to U.S. citizens, especially for West Virginians. So I think it's extremely important that we come through and we tell the pharma companies this is enough. We have a struggling, as Barbara said, we have a high diabetes population in our state, and I think it's extremely important that we look out for them in a meaningful way. And we have that opportunity. That's why we run for office. We run for office and want to be part of the government to help our constituents, to help West Virginians. And these bills specifically do that for people. These are life-saving medications, and I think it's past time that we put these on the agenda and we make sure we pass these bills to help our West Virginians. So thank you again. I appreciate the opportunity to speak to you all. I don't know who I'm passing the baton to.
You're good, Delegate Worrell. Thank you so much. Honestly, Barbara, I can let you take over, but we appreciate your thoughts for sure. We just want it to be affordable for folks to live in West Virginia, regardless of their health conditions. So, all right, I'm looking at our list here.
Senator Stallings.
Oh, yes, Senator Stallings, please. Welcome and thank you.
He needs to unmute.
Unmute, yeah. Thank you all very much. And Barbara, thank you for spearheading this again. Again, I'm an internal medicine doctor in my hometown of Madison, and been there for like 35, 36 years. So I do see the issue of affordability and compliance. And so that's why I went ahead and introduced Senate Bill 694 over on this side. I have spoken with the Chairman Azinger, who's the banking and insurance, which is where the bill is now. I've asked him to take a look at it, that I urged him to consider it because it makes good sense. And then a second reference to finance. So I agree, timing is really crucial right now. And we certainly want to get it past the House, the Senate, and then the House, or the House and then the Senate. So, by crossover. So it's important. And again, I see patients that literally cannot afford everything they're taking. Some people are taking a long-acting insulin like Lantus or Levemir, Some people, and then in addition, they're also taking, a Trulicity or Ozempic, and those medicines are very expensive because they also have to take other type medicines, ACE inhibitors to protect their kidneys from the dangers of diabetes. So, and then the testing supplies. So if we could somehow limit that out-of-pocket cost for the average West Virginian, we're doing the right thing. And we're also ultimately saving money, because you're not going to, if you have a hemoglobin A1C of less than 7, you're not as apt to develop all these daggone bad illnesses associated with the diabetes, the cardiovascular disease, the kidney failure, the blindness, the neuropathy, all those comorbid conditions that are clearly related to diabetes, not to mention early death, dialysis, et cetera. So if this is certainly something we need to push hard right here at the end and try to get us across the finish line here for the patients in West Virginia. And again, we lead this country in this category as well. A lot of diabetics here in West Virginia. If we're not first, we're in the top 5. So great legislation. I just hope we can get it across the finish line.
Senator, thank you so much for doing that for this cause. It's a big deal to West Virginians. I know myself, I have type 2 diabetes. Like, it's a big deal for lots of folks. And so knowing that our elected officials are considering this for us, I think it really matters to people. So I wanted to call up Gary Doherty. He is the director of state government affairs for the American Diabetes Association. So he can give us a little bit of perspective, please.
Thank you, Dr. Rice. My name is Gary Doherty, and I am the director of state government affairs for the American Diabetes Association. And the ADA is in strong support of House Bill 2708 and urges Chairman Pack of the House Health and Human Resources Committee to schedule the bill for a hearing as soon as possible. Similarly, we thank Senator Stallings for introducing the bill yesterday in the Senate as Senate Bill 694. As we've already explained, House Bill 2708 and Senate Bill 694 would reduce the insulin copay cap from $100 a month to $25 a month. But insulin is not the only expense related to diabetes. These bills would also cap monthly copays at $25 for other medications used to treat diabetes, as well as a $100 cap for diabetes equipment and supplies such as glucose monitors, test strips, other items that are necessary to successfully manage this disease. Diabetes is expensive. People with diabetes have medical expenses approximately 2.3 times higher than those who do not have diabetes. And diagnosed diabetes costs an estimated $2.3 billion in West Virginia each year. So patients often make decisions about their health care based on what they can afford. If the treatment is unaffordable, diabetes care will be delayed, or they could ration their insulin, putting the patient's health at further risk and resulting in even more costly healthcare services down the road. So House Bill 2708 and Senate Bill 694 are actually investments against even higher healthcare and emergency room costs that can be avoided. West Virginia can be a leader in diabetes advocacy again, and the American Diabetes Association urges support and prompt action on these bills. I would like to, if I might, turn the mic over to Mindy Salango, who has a compelling personal story that really illustrates the need for this legislation.
Thank you so much. My name is Mindy, and I just want to thank Delegate Flashauer. I'm proud to say she's my delegate. And she's really been at the forefront in fighting for diabetics for a long time. And I just want to thank her and the other legislators who are fighting so hard to help us out. I am a type 1 diabetic. I've been diabetic for the past 26 years. And so I'm pretty seasoned in my in my road with diabetes. But you've heard everybody talk about insulin and all the other things that go with it. So I created a little visual presentation for you. This is everything I use in a month, in 1 month. And insulin is just part of it. Thanks to the bill last year, I used 2 insulins. I'm not on a pump. I actually talked about that with my doctor, and I'm very well controlled with the pens. So we're sticking with it right now. But so last year after the bill passed, my insulin cost did cut in half. I was paying over $200 a month just for insulin alone. And as a single mom, that's a bit challenging, even in the best of times. And I have good insurance, so it's frustrating. I did go get filled. I hadn't had one of these filled in a while. And if you know what this is a glucagon kit. And this can actually save your life if your blood sugar drops too low and you go unconscious. It was $133, and that was with insurance. Luckily, my stimulus check came through, so I was able to afford it. Otherwise, I was going to have to forego this because I wasn't going to be able to afford to get it at the pharmacy last week. So I'm very fortunate. And I could go on about all this, so somebody may have to stop me. But I plan on being here for a long time to annoy my friends and family. So I want to do everything I can to be safe. I do wear a continuous glucose monitor, as you can see here. You get a pack of these to last you a month. And they're supposed to last 10 days each. They rarely do. And the company will send a new one, but if it goes bad in time in between being able to get the new one, you do have to have test strips and your regular meter to make sure that you are still in check. The continuous glucose monitor, I feel, is vitally important to be included in this bill because it saved my life several times already, and I've been on it less than a year. And I just visited my endocrinologist 2 weeks ago, and she was able to look, because it monitors 24/7. Every 10 minutes, it sends an alert to my phone as to what my blood sugar is. If my blood sugar is too high, it alerts me so I can correct with insulin. If it's too low, it alerts me so I can correct with food. And so it's vital. And my doctor was able to look at my trends and make insulin adjustments. So that, because I was going low in the middle of the night, at like 3 o'clock in the morning, very low, scarily low. And so this was able to alert me. Otherwise I could have gone unconscious and died and had my daughter or one of my family members find me that way. And that's not how I plan to go out. So she was able to adjust some things to help me. So to even those out. And our doctors can make better decisions when we're able to have the right tools and right medications. And so I think it's vital. I think this bill, as Dr. Ice said, and Delegate Flashauer, these bills are going to save lives. And that's the bottom line. It's like I've been in the situation where I have had to ration insulin because of money. It's terrifying. You don't know what you're doing to your body because high blood sugar and low blood sugar affects your entire body. You can have blindness, you can lose limbs, heart disease, the list goes on and on. Kidneys, it's overwhelming. So you've got to stay in control, and to stay in control, you have to have affordable access. And I say affordable access because I have access to a Lamborghini. I can't leave the lot with it without the money. So, you have to have affordable access to the care and the devices and the medication that we need to survive. Diabetics can't go without this. I will have every bit of this on my plate for the rest of my life. My pancreas will not work no matter what voodoo I try to do. This is it. This is me unless there's a cure. So we have to do what we can to keep our people alive and save lives. And that's what's important. Thank you.
Mindy,
I'm not sure who goes next.
no, Mindy, that was fantastic. I mean, you're just really showing, you know, what does it mean to have to live with diabetes, like the cost just to stay alive. You know, it's not just insulin like people think about, or, you know, watching what you eat so you don't eat too many desserts. It's more than that. And it takes equipment, supplies, other medications. And we should cover that just to be alive. I have heard that Delegate Rohrbach hopes to join us in this webinar. He's stuck in finance right now. So while we're waiting still, thank you, Mindy. Next, we're going to go to Laura Jones, she's the executive director of the Milan Pushkar Health Right Clinic. And I believe you actually have diabetes, don't you? I don't want to call you out, but where'd Laura go? Oh, you're on mute, Laura. There you are. You're right in front of me.
Okay, great. Thank you. I am Laura Jones. I'm the director of a free clinic, and we are able to access free drug programs for insulin for people who are very low income. However, those of us with insurance have a different story. And I celebrated my, if you want to call it celebrate, my 44th anniversary of type 1 diabetes on Sunday. And basically, I have been in the same situation that Mindy's been in, where I've had to, in my younger years in particular, I went through a period of time when I didn't have insurance. And there were no free drug programs then. So I had to ration insulin and get a job while I was in college in order to make sure that I always had extra money to cover my insulin. I also had an experience many years ago where I dropped my insulin bottle and it broke. And you can only get a 30-day supply from your insurance. So if it isn't time for your next bottle of insulin, you have to purchase it. Luckily, it was only $40 at the time. You can tell how long ago that was, because I know of people who are paying with insurance up to $600 for their insulin every month. And that's just not reasonable. That's twice the cost of my car payment. And when you realize that I will not survive more than about 48 hours without insulin, you realize what a fine line you're living on, and how one bad thing can happen to you. And if you can't afford your insulin, then you're in a difficult spot. And what I guess I really want to say is that making sure that people with diabetes have insulin and all the supplies they need, and diabetes education as well, and self-management education, is really prevention for us. It saves us so much money to be able to give people the tools they need to do what they need to do to survive and thrive. You know, I'm very proud to be here at age 57, 44 years later, because when I first became diabetic back in the dark ages, before all the technology that we have now, my life expectancy was about 32 years. So it's really important that we do this. And I appreciate Barbara and Senator Stallings for stepping out and making that a priority. Thank you.
Oh, thank you so much, Laura, for giving us your perspective. Yeah, there's no reason, why we shouldn't take care of these people. Our next speaker is Dr. Anderson, Doug Anderson. He is from the Eastern Panhandle Diabetes Coalition, and he has been a really key partner for us lately, trying to get the word out about all sorts of different things. But he's here tonight for diabetes. So, Dr. Anderson, it's you.
All right. Thanks, Jessica. Yes, I'm part of the new Eastern Panhandle Coalition for Diabetes. I'm also the chair of the health work group that works with Health and Human Services and the collaborative, as well as the family resource networks. So what I've been asked to do is just provide a complementary but an important perspective from the standpoint of say a system standpoint. I believe that there's a fact in every story. In fact, there's 219,000 West Virginians out there, or 15% of the population, that have a story. And we really need to extinguish that story. And what's happening now is 45,000 West Virginians don't know they have diabetes, and 502,000, or 34% of that population, have prediabetes. So this is an issue. There's a reason it's the 7th killer in the United States as a preventable disease and a surprise disease as well. And each year, 14,000 West Virginians are diagnosed with diabetes. And many of those cases come as a surprise. Many of those cases are based on environmental factors and other issues. But one of the big points, and I'm going to build on what Gary had talked about, is the direct and the indirect economic and emotional burdens of diabetes of individuals. Now Gary mentioned that medical expenses are 2.3 times higher than those without diabetes, and that's a fact. So this bill is about, for those in the room who remember the Fram oil commercials, it's kind of a pay me now or pay me later, or continue to let the oil leak out of the crankcase, because the total diabetes attributable productivity losses, and I'm talking about morbidity, presenteeism, household productivity, inability to work, absenteeism, costs West Virginia about $880 million a year. So why am I making this point? Well, this not only impacts individuals and families, it impacts employers and communities because of the costs. And so the indirect or the direct costs related to diabetes are the condition itself, and those were mentioned by our previous speakers. And so the direct and the annual medical costs, as Gary had said, are about 2.3 billion a year when you kind of combine the some of the direct and the indirect costs. And unplanned visits to the ER are one example, and that's a burden on the healthcare system. So for every story that we have, medical costs per patient are about $9,595 per diabetes patient. And so that's an impact. So there's like I said, there's 219,000 stories out there that are creating this burden, not only on individuals and families, but on employers and communities. And that's why we need to get behind not only diabetes, but also focusing on health as a national and a statewide imperative. And I think that we've started to do that. So 2708 begins to reverse the impact by approving the cap on copays for diabetics. But I want to come back and say that aligning and timing is opportunistic. For example, the West Virginia legislature enacted WV Code 161-21, which required the development of a West Virginia Diabetes Action Plan. Well, that plan's been approved. So now what? Let's move out on that. Let's start by investing in our people. In fact, the plan identified 3 surveys, and they implemented 3 surveys, and there were 3 needs: education, programming, and coverage. They reinforced, quite frankly, what we already know. Now is the time to move out. According to the plan, the top barrier to obtaining insulin medication to manage diabetes was high out-of-pocket costs. So that's why I say the alignment and the timing is important and opportunistic. And so the plan itself outlines 4 long-term goals and 5 specific recommendations, including increasing insulin availability. So let's get that flag and let's all run up the hill and talk about health and talk about following through on the plan that we paid for, and now it's approved, and all of the facts that support this. Because I can tell you the problem's not going to go away. If you look at the statistics from the Robert Wood Johnson Foundation in the county rankings, West Virginia counties have increased the prevalence of diabetes by 3 to 5% since 2015. And so the passage of 2708 it's fact-driven, it's story-driven, and the timing isn't right. It gives individuals relief on the purchase of adequate supplies, and it gives these individuals a fighting chance to stand up and be tall and be proud and improve their quality of life. So do what's
Dr.
right.
Anderson, yes, I'm 100% on board with Dr. Anderson. Thank you for joining us, Doctor, from gosh, where are you from? The Eastern Panhandle, I think.
Martinsburg.
Martinsburg. Okay, well, we appreciate having you here. And I would like to just point out we now have Delegate Robach here. Hi, Delegate. Thank you for being able to make some time for this. I know you were busy with finance, I heard.
Yeah.
But yeah, would you want to make any comments now?
Certainly. And thank you for having me, and thanks for hosting this. Obviously, as a physician, I've seen diabetes my whole career. And I think one of the things that makes this important to have this debate now, I'm old enough, and Dr. Stallings is old enough to remember that we had, just very primitive insulin when I was a young house officer compared to what we have now. The technology of treating diabetes has increased tremendously, as a lot of medicine has, but we have better forms of insulin, much better forms of insulin. And we also have much better monitoring systems. And I think, with continuous glucose monitoring, these are huge steps, insulin pumps, huge steps that have really made it possible for people to keep their diabetes under much better control. Now, the reason that's important And my friend, Dr. Anderson, just used the term that I used in the first press conference. You can pay me now or pay me later. Well, the end organ damage is really, that's just the devastating part about chronic diabetes, the heart disease, the cerebrovascular disease, the peripheral vascular disease, the renal failure, the dialysis, and we can go on and on and on. These things, by and large, can all be prevented with good glucose control. And we now have the technology that we didn't frankly have 40 years ago when I graduated medical school. We now have that. And it's the thing is, we've got to make it more accessible to people. So this bill, I think, helps in that regard. I think there's more we can do, frankly. But it really is the pay me now or pay me later. If we invest in good glucose control, then there's so much of the end organ damage and the chronic problems can be prevented. And again, as my colleague said, that it leads to happier workforce, healthier workforce. You don't have as much lost time at work. It's just, there's just so many things that are good about it if you keep your glucose under control. And I think that's what this legislation would help to do.
Thank you, Delegate Rohrbach. I'm so excited that we have such support for this work. This is so important for West Virginia because diabetes is such an issue in this state, and we all know it. From our delegates to our senators, to our doctors, to our advocates, we all know that this is a big deal. So I want to give a couple quick thank yous, and then I will ask if there are questions. So Delegate Fleischhauer, Delegate Rohrbach, Delegate Worrell, Senator Stallings, thank you all so much for putting something out there that's actually, for the people of West Virginia. So many of us suffer from diabetes, but we can live a healthy life. So at this point, I would like to ask anybody who has a question, if you're from the press or wherever, if you want to raise your hand. If you're on Facebook, you can post a question. It might be slow getting here, but Brittany will share it with me. So if there are questions for any of our doctors, activists, or delegates, or senators, let's throw them out there. Let me see, I'll look in here. Hold on. I'm trying to look at all my things. Doug actually asked a question, what are the counter arguments against this bill? Barbara, do you know, are there things that people are pushing back against from this? Oh, you're on mute,
I
sweetie.
think Matt can probably answer that better.
Okay, Matt, sorry, Delegate
I'm
Rohrbach.
writing.
As far as what the counter arguments are,
Yeah.
I mean, I'm sure the insurance companies aren't happy with it. Although that depends on where you, to me, I'd argue helping people keep their diabetes under good control really saves money in the long run. But insurance companies always tend to be focused just on the moment and not maybe the big picture, because in the big picture, you save enormous amounts of money. But I'm sure the insurance companies are happy.
Yeah. So Barbara, have you seen any or heard any pushback from this?
I have talked to PEIA in particular.
Okay.
I asked them for a fiscal note and they gave me a fiscal note of 0. The version that Senator Stallings introduced has some changes to it that made it more cost effective for them. Actually, I would like to ask a question of Senator Stallings and Delegate Rohrbach. Delegate Rohrbach, Dr. Rohrbach here, but I checked on the Connecticut voting, and it passed the Senate 35-1 and the House 145-0. And I just want to know, is there any chance we can get it on the agenda this year? And if there is there anything anyone in this group can do? Because right now it's just stalled.
Yeah, it's
Barbara,
frustrating. I think, yeah, what you can do, advocate to the leadership to try to get it moving.
Ron, you,
Yes, so Barb, I've already asked Senator Azinger to take a look at it and to please get it on the agenda as soon as possible. I also mentioned to him that your same comment that PEIA said that it should be a zero fiscal note. I would venture to say, like Delegate Rohrbach, that it would probably be a, save tens of millions, if not hundreds of millions of dollars if this bill passes, certainly through Medicaid and PEIA.
So what I hear Senator Stallings saying and others is that this, like our fiscal note is nothing, right? So it is in making sure that the insurance companies and others are on board. I saw in the notes that like our PEIA supports this bill, which would make sense, right? If you do preventative care now, you save money later. And I think a lot of insurance companies are actually realizing that.
actually, Jesse, I don't think that's totally accurate. PEIA is not allowed to take a position on bills.
Okay.
They have worked with us in formulating this bill. Senator Stallings' bill was adjusted.
Oh, I didn't mean their position, Barbara. I'm sorry. I'm so sorry. I meant that.
But I think the issue is the private. I think what Delegate Rohrbach is talking about are the private insurance companies. And
Yeah.
I've spoken to them. And Matt, have you talked to any of them? They haven't said, we hate this bill. To me.
They've not talked to me, but they know I'm for it. I suspect that they've talked to others, maybe. I don't know.
I think the next step is to talk to the chairman of wherever the bill is. In my case, it's Senator Azinger. Just talk to him, put some pressure on him to run the bill and to educate him up. It's entirely up to the chairman of the committee, and this makes all the sense in the world. And then if we can get it through that committee, it's second reference to finance, and then it would be Senator Tarr. So that's the mechanism, and whether or not the Diabetic Association or anybody on this call could bring pressure to bear, if you would, on the Senate side, and then I guess the Senate Health Committee is up on the House side. So that's the next step.
Right, Matt, it's referred to the Health Committee, and then does it have a second reference or does it go straight to the floor? I can't remember.
Finance. Yeah, and the Senate's obviously taking an interesting approach by going at it more of just an insurance issue, which I can't argue against that. That's probably a decent approach.
Let me break in here real quick with a question from a reporter, Erin Nguyen. Thanks for joining us, Erin. She wants to know what the status of the bills are. And also for Senator Stallings, I believe that Azinger was the only senator who voted against the insulin bill last year. Does that concern you for this session? She's working on a story for tonight, so she appreciates everybody and she says thank you. So. For
694,
anyone here.
the status of 694 is it's pending in banking and insurance. The chairman is Senator Azinger. It's second reference to the Committee on Finance. And Barb or Matt would have to talk about the House version.
Well,
Thank you, Senator.
I will add that I've talked with Delegate Westfall, who is the chair of the Insurance Committee, and he is very supportive of the bill. But he's not on the Health Committee, and it's Jeff Pack, who's the chair of our Health Committee, who is the one that makes the decision to get it moving on our side. And he seems reluctant. I think because of these market issues, he thinks, as people have said before, that it's some kind of price control. Am I right about that, Matt? Is that?
I believe that to be correct. And I think that, so the Senate has chosen to go a different route, more from the insurance angle. And frankly, I think that's probably a pretty reasonable way to approach it.
Well, except for the fact that the only person who voted against the bill last year on the Senate side.
Yeah, see, I wasn't aware of that.
Right. So, hold on 1 second. So, okay. I believe that we've had all of our speakers. However, if folks, we've got 3 delegates, a senator, and other folks on. If anybody would like to give some final thoughts on this legislation, this bipartisan legislation to help the diabetics in West Virginia, I want to give you all the final floor. So I guess we can start with Delegate Fleischhauer. Any final thoughts?
Well, I just have to say that a lot of people have given me credit, but this could not happen without bipartisan support. And it happened last year with enthusiastic bipartisan support. And I'm very grateful for Delegate Rohrbach and Delegate Worrell to be joining with us on this, and Delegate Westfall, who chairs the Insurance Committee. We need to convince Delegate Pack, and I don't know if we're going to be able to do that, and Senator Azinger. So, we need a little help here. We did amazingly last year, and that Connecticut example, I think, Connecticut is the headquarters of the insurance industry. And if they were unanimous, why can't we do it here where the toll is so much greater? I don't know if that's a persuasive argument or not, but I appreciate all of the advocates who are on here today, and especially those who told the stories from your life. Thank you for doing that.
Oh, heck yeah, Delegate Fleischhauer. Those stories, they're like heartbreaking almost, right? Like, to choose between living and paying your bills, I just can't imagine. All right, so Delegate Rohrbach, Dr. Rohrbach, any final statements? Oh, you're on mute. Hold on.
I'm sorry, I am on mute. Sorry. Yeah, I think it's an important bill. I hope we can get it moving in some form, and if the Senate has more luck through the insurance angle, I'm all for it. But again, it does affect real people with a real disease that is treatable. It's very treatable. And we have the technology available now. So hopefully we can get something moving and kind of go in the right direction. I hope this year. If not, then we'll keep working. But there's some momentum here, I think.
Well, Delegate Rohrbach, we're happy to have you as a healthcare advocate for sure. It's always nice when people actually know, what happens with healthcare, and we so appreciate that. Let's see, we've got. I definitely want to make sure Senator Stallings has, if he wants any last comments. I don't know. Is he still on here?
Yeah. Thank you. Thank you. And again, you know, to the Speaker of the House, talk to the majority leader. Our majority leader is a physician. You know, so that you know, again, we just need to bring to bear the pressure, if you would, or the educational aspect to the chairman of the committees where the bill lies, and get it moving. So I'll be working on the Senate side to try to, and I'll talk to you know, there's 3 docs over there. There's myself and Senator Maroney and Senator Takubo, and so maybe we can bring some pressure. And again, you know, Senator Azinger is aware of it. He knows that I've asked him to look at it and to consider putting it on the agenda. So, and I'm sure Matt and you know, Barb and Delegate Worrell can you know, put some pressure maybe on Delegate Pack if necessary. That's where we are. It's whether or not we'll get those bills, the bills on the agenda matters more than anything right now. Thank you.
All right, thanks, Senator. I mean, I really appreciate you putting that bill forward, Senate Bill 694, to complement House Bill 2708, so we can get that moving. I really appreciate everybody's dialing in right now. The only is Delegate Worrell still here? I think he may have had to hop off. I wanted to offer him a last comment, but he had to go. I mean, here we are. It's you know, coming down to the wire. I think that we have a real opportunity here to help West Virginians with diabetes. So let's all pay attention to where this is going, pitch in where we can. I think Mindy, where you at? Would you, I don't want to put you on the spot, but you might have something to say to close this out for us?
Yeah, just kind of listening. I got a little teary because it feels like we're being reduced to numbers on a spreadsheet. And we are more than a number on a spreadsheet.
Yes.
We're lives, and we're West Virginia lives, and we're dying. And I mean, and I don't say that lightly. West Virginians are dying due to lack of affordable access to care. And this is the opportunity to save lives. And I can't see how we could say no. So thanks to everyone who's working so hard.
Thank you, Mindy. Thank you, everybody. Barbara, any last words or? No, you're muted.
Anyone can summarize things any better than Mindy, and I need to hop off now because I have another meeting. Thank you all. And
all right, thank you all. We'll call this meeting to a close. We appreciate you all for everything. Bye.